Good morning students. Today we are going to discuss about acid base disorders. We already discussed about what are the acids, what are the bases and mechanism of regulation of pH. Today we are discussing about acid base disorders. Acid base balance depends on the ratio of bicarbonate and or carbonic acid, which is the constant ratio is 20:1 at physiological pH. Any alteration produced in the ratio between carbonic acid and bicarbonate, its result in acid base imbalance and leads to acidosis or alkalosis. What is acidosis means? It defined as abnormal condition caused by the accumulation of excess acids in the body or by the loss of alkali from the body. That is called acids, and alkalosis is abnormal conditions caused by the accumulation of excess alkali in the body or loss of acids from the body. So this is the acids and acidosis and alkalosis. Next, coming to the acid base imbalance types, acidosis and alkalosis. Under the acidosis, respiratory acidosis and metabolic acidosis. In respiratory acidosis, increase in partial carbon dioxide or bicarbonate. Metabolic acidosis means decrease in bicarbonate. Alkalosis are two types: respiratory alkalosis and metabolic alkalosis. In respiratory alkalosis, decrease partial carbon dioxide. Metabolic acidosis, increase in bicarbonate ions. These are the types of disorder, acids and alkalosis. Acids, respiratory acidosis, metabolic acidosis. Alkalosis, respiratory alkalosis and metabolic alkalosis. Next, coming to the metabolic acidosis. Metabolic acidosis means decreased blood pH due to decreased in bicarbonate levels of plasma is called as metabolic acidosis. Primary changes: decrease in bicarbonate levels, that is the primary change, decrease in bicarbonate levels. Next, causes of metabolic acidosis. It's caused due to diabetic mellitus or ketosis. In diabetic mellitus, decreased in bicarbonate levels may be due to increased production of acids. In uncontrolled diabetes and starvation, there is a excess production of acetoacetic acids and beta hydroxybutyric acid. These acids are buffered by utilizing the base component of bicarbonate levels. The concentration of bicarbonate levels are decreased to increase the bicarbonate deficient and result in metabolic acidosis or ketoacidosis. Next one is lactic acidosis. In lactic acidosis, increased production of lactic acid occurs in different exercises. Next one is renal failure. In renal failure, kidney may not be able to excrete the acids in sufficient amounts, that leads to retention of acids in the body. In diarrhea, next one is renal tubular acidosis due to loss of bicarbonate ions. These are the causes of metabolic acidosis. Metabolic acidosis means decreased bicarbonate levels of plasma. Then primary changes: decreased bicarbonate levels. Then causes of metabolic acidosis is diabetes mellitus or ketoacidosis, lactic acidosis, renal failure, diarrhea, renal tubular acidosis due to loss of bicarbonate ions. Next is the compensatory mechanism. Metabolic acidosis is compensated by respiratory compensation occurs due to increased pulmonary respiration. This results in removal of carbon dioxide from the body fluids. Increased excretion of H plus ions as ammonium ions and increased excretion of acid, that is dihydrogen phosphate in urine. These are the compensatory mechanism for metabolic acidosis. Next is the metabolic alkalosis. Metabolic alkalosis defined as increased in blood pH due to increase in bicarbonate levels of plasma is called as metabolic alkalosis. What are the causes for metabolic alkalosis, sir? Loss of H plus ions in gastric fluid due to vomiting. Loss of gastric juice along with H plus ions in prolonged and severe vomiting. And therapeutic administration of large dose of alkali and injection of abnormal alkali such as disodium carbonate. Then hypokalemia. Hypokalemia means decreased potassium levels. In hypokalemia, when potassium levels is depleted, more H plus ions are exchanged for sodium. So the urine becomes more acidic and the body fluids are more alkali. This result to alkalosis, that is the hypokalemia. And these are the causes of metabolic alkalosis. First one is loss of H plus ions in gastric fluid due to vomiting and injection of abnormal alkali such as disodium carbonate and hypokalemia. Compensatory mechanism is metabolic alkalosis is compensated by increased excretion of alkali, that is bicarbonate, by the kidneys and diminished formation of ammonia, and respiration is repressed to conserve the carbon dioxide. These are the compensatory mechanisms for metabolic alkalosis. See here, in blood gas H plus ions are increases or decreases. If H plus ions are increases due to acidosis, this acidosis pH is decreased and bicarbonate also decreased, that is called metabolic acidosis. If H plus ions are decreased, pH is increased and bicarbonate levels are increased, that is called as metabolic alkalosis. Next is coming to the anion gap. What is anion gap means difference between total concentration of measured cations and that of measured anions. Cations are sodium and potassium. Anions are chloride and bicarbonate. The total concentration of cations and anions is equal to maintain the neutrality in the body fluids. Sodium and potassium constant is about 95% of plasma cation and 80% of chloride and bicarbonate. The remaining 20% of plasma anions include proteins, phosphate, sulfate, urates and organic acids. What is anion gap means the difference between the total concentration of anions and to concentration of measured cations or anions. See, anion gap represents the unmeasured anions. Anion gap represents the unmeasured anions in the plasma. That means cation minus anion. Normal range of anion gap is 8 to 16 milli equivalents per liter. For example, anion gap, cation minus anion. Cations are sodium and potassium, and anions are bicarbonate plus chlorides. For example, sodium ions is 42 plus potassium level is 4 minus 27 is bicarbonate level plus chloride ions is 103. Total 146 minus 130. The anion gap is 16 milli equivalents per liter. This is the normal range of anion. Next is, what are the causes for anion gap? Normal anion gap, increased anion gap and decreased anion gap. Normal anion gap is in diarrhea, renal tubular acidosis, carbonic anhydrase inhibitors, and use of drugs like antacids containing magnesium, chloropromide, iodide and lithium. These are the normal anion gap causes. And increased anion gap causes renal failure, lactic acidosis, metabolic diabetic ketoacidosis, hypokalemia, decreased potassium levels, decreased calcium levels and decreased magnesium, aminoacidureas, organic acidureas, methanol poisoning. In these conditions, increased anion gap is increased, and decreased anion gap is decreased albumin levels, that is called hypoalbuminemia, hypercalcemia, hypermagnesemia and hyperkalemia. These are the increased, decreased and normal anion gap causes. Next, coming to the respiratory acidosis. Respiratory acidosis means increase in partial carbon dioxide concentration due to impaired alveolar ventilation. Respiratory center is inhibited, causing irregular breathing and result in carbon dioxide is retention in the body. So, causes of respiratory acidosis is airway obstruction and neuromuscular disorders and disease of the central nervous system. In obstruction to respiratory, this may occur in pneumonia, emphysema, asthma, etc. and cardiac arrest due to severe hypoxia, weakness of respiratory muscles seen in poliomyelitis and myopathies. Then administration of respiratory depressant toxic drugs are morphine depresses the respiratory center. Morphine drug depresses the respiratory center. These are the causes for respiratory acidosis. First one is airway obstruction, chronic obstructive airway diseases and cardiac arrest, weakness of respiratory muscles and some toxic drugs, that is morphine. This depresses the respiratory center. Next, coming to the compensatory mechanisms. Respiratory acidosis is compensated by increased renal reabsorption of bicarbonate and increase in urinary acids, that is dihydrogen phosphate and ammonia. Then stimulation of respiratory center by carbon dioxide except in depression type. These are the compensatory mechanisms for respiratory acidosis. Then next one is respiratory alkalosis. Respiratory alkalosis means increase in blood pH due to decrease the concentration of carbon dioxide or carbonic acid due to hyperventilation. That is called respiratory alkalosis. Then causes of respiratory alkalosis are high altitude, hyperventilation, fever, pulmonary edema, congestive cardiac failure, septicemia and meningitis. These are the causes for respiratory alkalosis. Then respiratory alkalosis compensated by reduction of urinary ammonia formation and increased excretion of bicarbonate. You can see here, if H plus ions are increased, decrease the blood pH and partial carbon dioxide is increased. This leads to respiratory acidosis. Then H plus ions are decrease the blood pH levels and decrease the partial carbon dioxide. This leads to respiratory alkalosis. Next, coming to the normal references values. Normal range, pH normal range is 7.35 to 7.45. Partial oxygen is 83 to 108 mmHg. Partial carbon dioxide is 35 to 48 mmHg. Bicarbonate is 22 to 26 millimoles per liter. And sodium is 135 to 145 milliequivalents per liter. Potassium normal range is 3.5 to 5.0 milliequivalents per liter. Chloride ions is 118 to 132 milliequivalents per liter. These are the normal range for pH, partial oxygen, partial carbon dioxide, bicarbonate and electrolytes, sodium, potassium and chloride.